Henry Zanetti is a 94-year-old and a World War II veteran. His family moved him to the Holyoke Soldiers Home following the death of his wife in 2019 and a broken arm last July. His daughter and healthcare proxy, Mary Klicka, told us that because of that tremendous change, routine has become vitally important. But she learned that routine was upended last week when Zanetti was abruptly moved to a floor without telephone access. Klicka said she spent several long days worrying, prohibited from visiting, and unable to speak with her father or get an update on his care from anyone at the Soldiers Home. Zanetti called Klicka from a borrowed phone Monday morning before news of 11 recent deaths at the home, some of which have been attributed to the coronavirus. She reached out to Connecting Point earlier this week and asked us to look into her concerns, which we did, and we're still awaiting a response. Meanwhile, we spoke with her today about the breaking news.
Well, the beginning of last week, we were told that there was one positive case in the building, and they had been quarantined. And then Thursday afternoon, we were given a call that everyone on my father's wing was going to be moved to the floor above them the next morning. At that point, they couldn't tell us what his room would be, if he would have the same nurses or doctors, if he would have the same roommates. We were told he would not have the phone, and they couldn't tell us when they would be able to connect those. They said we could not send him a cell phone. We could only send cards and letters. Then we really didn't hear anything. I got through to the nurses station on Sunday and learned his room, but that's the last contact we've had with anyone from the Soldiers Home.
And so when you were asking them specifically about sending in a cell phone, that was so that you would be assured that you'd be able to communicate with him? Was that your hope?
Yes, the phones there, each resident has an account with Verizon, so his phone was attached to his room, and they said they wouldn't allow Verizon in to connect the phones up to the new floor. So the only way he could speak with us if the nurses were able to bring him down to the nurses station when they had a chance in between taking care of other residents to sit with him and let him talk with us, which from Friday through Sunday, there hadn't been an opportunity at all, and it didn't seem like that would happen very often.
And so you were able to speak with him, as I understand, on Monday morning. What did you discuss?
One of the nurses' aides let my father use her phone quickly just to call, and he wanted to know if we were all right, because he's aware of what's happening, and he was very concerned. I'm a nurse, and my daughter is a pharmacist in Philadelphia, and he's very concerned that something might be happening to us, and we were also very concerned about what was happening there. We could sense the urgency when we did have any contact with a Soldiers Home, but there were very few answers, which just didn't feel quite right. And so that made us very anxious for his welfare.
And what did he say about how he's feeling right now? How is he feeling?
Well, he seems a little more confused and uncomfortable and worried, but his voice sounds okay. But things can change so quickly that, without being able to talk to him daily, it still makes us all very worried.
And when did you ask him specifically, are you concerned about whether he has any of the COVID-19 symptoms, or is that something that you've asked him directly about yet?
No, we didn't discuss that. If he did or didn't, we really don't, there's nothing we could do about it at all. So I didn't want to, put that in his head to make him worry more. I'm not there to observe the symptoms or to take any action on it. So we didn't discuss that.
Because right now you were notified a few weeks ago that visitors are not allowed because of the situation that's happening, correct?
Correct. So we haven't been able to see him in several weeks, and we were keeping in contact by speaking with him several times a day. And now that route is cut off also.
And as you mentioned, you're a nurse. When you have visited in the past, what's your assessment been of the care that you've observed your father receive or the care you've seen others be given?
Well, we feel that they take very good care of my father. The staffing is short, but being a nurse and having a parent in other facilities at times, we know that's pretty much the status of things everywhere, and we feel that he probably gets the best attention possible there that we've seen in other facilities. So we've been very satisfied with that up until this point.
Mm. And as I explained, you and I first spoke on Monday, and I want to let our viewers know that we did reach out to the Soldiers Home. I spoke briefly by phone with Deborah Foley, who's the communications person for the Holyoke Soldiers Home, and I was directed to send any questions that I had or relating the questions that you had directly to her via email. I confirmed that she did receive that email, but we haven't had any response to your questions or the questions that we've had as of yet. We're hopeful that we'll receive some sort of response. If you could speak with someone from the Soldiers Home, what's a question that you would really like answered at this moment?
Well, there's a couple things that my family would want to ask. We'd want to know how we could talk to my dad at least daily, how we could get prompt and accurate updates from the Soldiers Home daily, and what's the plan for dealing with changes. If my father does show symptoms, any test positives, then what? How would that be accommodated? How would he be treated? Would he be moved down to the floor where they have other patients quarantine, or just what is the plan?
And in terms of why he was moved, were you told anything about details of why he needed to be moved?
We were told simply that it was a staffing issue. We kind of sensed that there was more behind that, but that's all they would say. It was a staffing issue.
And as I understand it, you're in contact with some other people who have loved ones at the Holyoke Soldiers Home. What are you discussing with them, or what are you hearing from them?
We've pretty much been communicating by email, just asking questions and seeing if anyone else has gotten any more information or answers. So far, none of us have. So we're just kind of setting up pathways that we can communicate and share any information when we are able to find it.
And I understand that you're your father's healthcare proxy. You have 3 siblings. You're one of 4. Your parents were married for 63 years. Is that correct? Before your mother passed away last year?
Yes, it is.
And so you're the primary person who's speaking with your father and relating that information to your siblings. Is that how this has been working?
Yes.
And what questions, if any, have they had for you?
Pretty much the same that I have. We talk together, and they have the same questions: how to be able to talk to Dad, and how to find out what's going on up there.
And prior to the health concerns that clearly have arisen given the number of deaths that have been experienced and also the questions about who may have COVID-19 at the Soldiers Home, how are you dealing with your concerns about this?
We really haven't found any good ways to deal with it except for watching the news and going online. And now, the last few days, being able to reach out and ask questions and find other people who are doing the same.
Yeah. And in terms of how you're handling this with your dad, when you spoke with him yesterday, did you just try and keep things as light as possible, as normal as possible? How did you sort of conduct your conversation with him?
I tried to just be reassuring with him that we were all right, that he didn't have to worry about us, and kind of just sense how he was doing, asking him how he was feeling. Was it, how his room was? Was he able to sleep at night? And, did he have someone there that can help him when he needed to use the bathroom? And how his day was going. And he sounded all right. He sounded a little anxious, but it was good to hear his voice. It was very good to hear his voice.
Yeah, I bet. In terms of how you typically corresponded with people at the Soldiers Home, prior to this, did you have challenges finding out anything about your father's level of care, or just, getting a standard question answered?
It is a little bit challenging. The nurses do what they can to answer our questions, and if there is something that needs follow-up, they make a notation for when the doctor comes around. But sometimes we might not get an answer for a couple days. And I have yet to ever see the doctor. He's been there since July, and I don't think I've ever seen the doctor. They're supposed to have every 3-month reviews of each resident's case, but my father moved there in July, and we had never had a review until February, although I'd asked several times. And then when there was a review set up in the end of February, the only one who was available at the time that was planned was the social service person. No one else was available to come to the planned meeting to review his experiences there and his care.
even though you had been assured that a doctor should and would be there?
Well, we weren't told what staff. We were told it would be an interdisciplinary meeting, which, being a nurse, I assumed meant there would be a nurse, a doctor, physical therapist, the people who are most involved in his care. But that didn't happen. The social service person took down our questions and said he would relay those to the people who were appropriate, but really not much came of it. So I was very disappointed with that.
And in terms of the measures that you've heard about on the news that the state has taken thus far, are you satisfied? What are your thoughts?
Well, I really don't know what measures they've taken. I've heard that they've set up tents outside to screen employees going in, but and that they're doing better sanitizing. And they talk about different agencies getting involved, but I actually don't know specifically what's happening and how that's affecting my father's day and his safety.
Oh, sorry to interrupt there. One step that we know of is that the leadership there at the Soldiers Home has been put on administrative leave, at least for the immediate time. What about that step?
It seems appropriate to me. I would think that communication with the families would have been one of the top priorities, and that seems to be totally overlooked. So that's a pretty big gap. So it seems appropriate to me that there is a change, and especially since listening to the news and listening to Mayor Morse, that the town wasn't, or the city of Holyoke wasn't even informed of the situation. And I would think their Board of Health would have been more than a little interested in knowing what was going on in their backyard. So I think that was, again, another big blunder.